gave us decimal scale, centesimal scale, and now the latest advancement is 50 millesimal scale. So in LM potency came in 6th edition, right?
Yes.
Till 5th edition, Hahnemann was advocating centesimal potency. And what Hahnemann was advocating? Single dose, minimum dose, not single, minimum dose. The minimum dose which is required to stimulate your vital force. Right? That is minimal. That minimum can be subjective. One dose for maybe him, and for her maybe 4 doses. For her maybe BD for 1 week. That will be minimum dose for her. Single dose will be minimum for him. 2 doses for minimum for her. So minimum is subjective, but minimum doses. And what Hahnemann said, you have to wait to exhaust the action of last dose. You have to observe carefully, then repeat the next dose. That is what Hahnemann was advocating till 5th edition. In 6th edition, Hahnemann came up with 50 millesimal potency. And the reason he gives that, if you read 6th edition, 246, 247, aphorism number, what Hahnemann says, why to wait for a month, for a 15 days to repeat next dose? Can we shorter the duration? Can we get the result faster? Is there any way to get result faster, to cut short this period? So he said, because of that, I was doing continuous experimentation and I have come up with this new type of potentization, which has he called as 50 millesimal of LM potencies. So what he said, in 50 millesimal potencies, they are ultra potentized, very highly potentized, so you can repeat it safely without having aggravation. That is what Hahnemann said. So what he said, 50 millesimal potency in chronic diseases, you can repeat daily or alternate day, if needed 6 hourly, 1 hourly, or more frequent, more often in acute disease, is what he said. So Hahnemann said, now there is no need to give single dose and wait for a longer time to see and then act. You can do it faster with the help of LM potency. You can repeat it safely. Okay. So now we use 50 millesimal potency, especially in structurally advanced pathologies, where you don't have much time. You have to act fast, but there is chance of aggravation. You don't want untoward aggravation. Advanced pathology patient can go in the aggravation, and there can be a very, what you can say, the consequences will be very difficult, right? Patient may lose his life. So you have that fear also. You want to repeat also frequently, but there is risk also. So in such cases, we prescribe LM potency. So LM potency is what Hahnemann says, the chances of aggravation is very less in LM potency. That's what Hahnemann has observed. So you read aphorism number 246 to 250 and 269 to 70. Read this aphorism from 6th edition. In this, Hahnemann has given about 50 millesimal potency. So what we do, what I follow, whenever pathological case is there, advanced pathology is there, cancer-like case is there, renal failure is there, tumor is there, I start with LM potency. So in cases of cancer, in few cases of cancer, what I will tell you one case of cancer where that patient had CA ovarian cancer, metastasis to liver. Because of in liver, she developed edema, right? Hepatotoxicity. They gave targeted chemotherapy, but she did not respond. She got worse. So they discharged from hospital. You take your patient home. She will maybe survive for a few days. Take good nursing care. Okay. So we took the case. We started that case of also arsenic. We started arsenic 0.34 hourly. Right. So her edema went away. She started talking. She started eating. She regained the energy. There was no weakness. Now it's 2 years. She is doing fine. She is traveling, she is eating, she forgotten about cancer. So I gave arsenic 0/3 4 hourly. I have seen in my cases LM repetition works in advanced pathological cases. That is what Hahnemann has said. You can shorten the period. You can prescribe it safely without aggravation. That is what I have seen in my cases. So these are the cases where I will prescribe LM potency. Second criteria, when I am prescribing, disease is not progressive, right? Not advanced. For example, disease is asthma, not life-threatening, not advanced pathological disease, okay? But at times in acute attack, it can be, right, very difficult for patients, troublesome for family also. If you prescribe remedy in centesimal potency, remedy is responding, but you feel there is limitation. Patient responding to remedy, but there is limitation, not going beyond. You tried, you are giving higher potencies also, 1 m, 10 m, 50 m. Remedy is same, but you are not going beyond a certain response. In those cases also, I start with LM potency. I give chance to LM potency, and in few cases I have seen where remedy is same, but there is limitation is coming to centesimal potency. I will give LM, and I have got result in those cases also. So in those cases also you can think of LM potency. Okay.